In 2007 we were paper-based, in 2008 we moved to Liquidlogic and never looked back since.
I think the main challenges we face within North Yorkshire is that the county is quite vast, which involves quite a lot of travelling between bases and when doing visits to clients and service users and other agencies.
The social workers having laptops, at least we can take them with us to meetings in other areas throughout the county that we cover. It makes my job, a lot easier, and it assists the social workers.
The system we had before was a simple database, and it just gave you the basic details, names, addresses, ages, stuff like that, what had been going on. But there were no reports in there. If you'd had a meeting, it wasn't on that system. There was no way of uploading it or anything. With the protocol, it's there. You simply click on it and there's the report.
Well, you're talking to a bit of a dinosaur, so this is the first computer system that I've ever used to inform my social work practice. One of the things I would say is that people that have come in from other agencies who've used different systems have always said that they've felt that Liquidlogic was one of the easier ones to get to know. So these are people who have had experience with other systems.
Easily to navigate through it, really, compared to the other system that I did use. It's like the tabs across the top of the screen are really useful and it's quite self-explanatory.
I would say it's very user-friendly. I think the training that we've been provided since actually starting in the job has been excellent, really, and there's a lot of people that we can contact who have got good knowledge of how to use the system, which is extremely useful.
In terms of my job, it's kind of checking out what workers are doing and checking that my team have balance of cases and are keeping up to date with all their reports and things. So as a manager, it's really good to be able to click into individual workers' work trays, and you can see even with the colour scheme who's not done a report yet or who's about to do a report.
The child's voice is so much more accessible for me as a manager. I'm able to go into the case, easily access the views of the child, which gives me a total different picture of what's going on. I'm really able to capture them issues and how it feels for that child.
Until you actually have access to it and actually using it yourself, you don't actually understand the entire features of it, really. And I think the best experience you do get is actually using it.
And it does offer rewards to the user, because you feel more efficient. I think you feel more in control to a certain extent, and being a control freak, that's good.
For ourselves in the Access and Impact team, we have allocations meetings every morning, and we use Liquidlogic in those allocations meetings to map out new cases that we're getting, and we look quite easily at the history of that family, and we use that constantly.
I think it's certainly improved the standard of work that we're doing in North Yorkshire and able to move forward with the current model.
We have a lot of complex cases with a lot of people involved, not necessarily with families that are from the local area. Liquidlogic brings all the information together about young people and about the families in a very clear way.
When you work with another local authority that is using the same system, for example, if you've got a transferring in or out child protection conference, it's really reassuring when you know that they're using the same system, so that when the reports are generated, you know exactly what you're looking for on their report, they know what they're looking for on our report, core assessments, etc. Because it's the same system that's generated, you know where the information's going to be.
Obviously, there are times when the allocated caseworkers on particular cases aren't here, holiday, sickness or whatever. If something comes in that needs to be done, then the duty social worker or another colleague can quickly get key information. It's in the same place on every single file, which is, a definite advantage.
We use the system to help the social workers with their tasks and take off some of the administrative burden, if you like. So we can arrange meetings, we can record meetings. The system actually enables me to do my job. If it wasn't there, I'd be going back to the old typewriter stuff.
So if you'd have asked me that question back in 2008 and as to whether I would recommend Liquidlogic, I think I would perhaps have had some reservations at that time. But now that the system has improved and developed and can now meet our needs as a local authority, I would definitely be recommending it to other people to give it a go, yeah.
I think for the families it's much better than the paper-based system that we had, because if a family phones in, to the team support worker, or if their social worker's not around, if they speak to another social worker, they have easy access to that file at their fingertips, really. They know where everything is. They don't have to go away and search through a file for the information they need, and the family don't have to repeat themselves over and over again to lots of different people.
There's a change in the culture of how we work and what we do. But now we've had it for the last 5 years and we're up and running with it. Yeah, you can't see how we ever kind of managed to record things so effectively before or keep track of things. So I definitely recommend it.
It's been totally accepted, I think. I don't think there's anybody left now who says, I wish we could do it another way.